Hello, everyone, and welcome to today's webinar on individual coverage health reimbursement arrangements, or ICHRAs. I'm Chris Bird, a member of the Employee Benefit Research Institute Board of Trustees and a senior vice president at WAX, a provider of software and services to the employee benefit market. It's a pleasure for me to be able to moderate this session sponsored by Zorro. Today's webinar is a really timely one, and the number of people who signed up to attend is testament to that fact. While ICHRAs have been around for nearly 6 years now, signs of increased interest and adoption are really starting to appear more and more often in the marketplace. For decades, health policy experts and employers have debated whether employer health benefits might shift from a traditional defined benefit model to a defined contribution approach, giving employees a set allowance to purchase coverage of their choice. ICHRAs may offer the most viable pathway yet for those considering such a change. Today on this webinar, we're going to explore the growing role of ICHRAs in today's health benefits landscape and their potential to reshape employment-based coverage. We'll examine emerging technologies that could accelerate adoption and share real-world case studies of how brokers and employers are leveraging ICHRAs to control rising costs while giving employees the power of choice. One lighthearted addition, ICHRA may be one of the worst acronyms ever come up by the federal government. I did go on Gemini, Google Gemini, to see if I could come up with a more creative and pithy acronym. It gave some pretty good answers. The one I kind of really liked was personal health empowerment. But then I had to ask the prompt and say, well, you got to make it an acronym that can actually be like a word. And it came back by adding a W to the end. So I don't think that works. So I think we're stuck with ICHRAs. Next slide. Today, you're going to hear from two people who probably know as much about this product as anyone in the country. First up is a man who I don't think needs any introduction to this audience, Paul Fronston. Paul's Director of Health Benefits Research at IBRI. He has many research interests, including trends in employment-based health benefits, employee benefits and public policy, health plan design, and public opinion about health benefits and healthcare, and that's just to name a few. He currently serves on the board of trustees for the Emeriti Retirement Health Solutions, and he also serves on the National Advisory Board for the University of Michigan Center for Value-Based Insurance Design and the board of the Mid-Atlantic Business Group on Health. After Paul, we'll hear from Ben White. Ben's vice president of partnerships at Zorro, an ICHRA administration platform that helps brokers sell, employers buy, and employees engage with more affordable, predictable, and customized healthcare benefits. Through his work at Zorro, Ben seeks to maximize and strengthen partnerships across the industry. Ben's a licensed health and life insurance agent who brings with him over 30 years of business and industry experience, including almost 5 years in the ICHRA space. Next slide, please, John. So we'll leave plenty of time for the audience to weigh in with your questions and comments at the end of the prepared portion of this program. So to ask a question, just click on the chat box at the bottom of the screen. Now, most of you may know how to do this, but if you don't see that little chat icon, you may need to move your cursor to the bottom of the screen and it will pop up and appear. And then you can enter your question in the bottom right-hand corner of the screen as shown here. Your questions will be answered at the end of the session, but you can submit them at absolutely any time during the course of the presentation. For those of you who are only listening via phone, please email your questions to info@ebri.org. That's info@ebri.org. And that can also be used for those who, for any reason, can't use the chat box who are on the webinar here live. Whether you're on the phone or whether you're watching via Zoom, the slides and a recording of this session will be available on the IBRI website, perhaps as soon as tomorrow. Next slide, please. Before we hear from Paul, we do have a poll question for our audience. And the question is this: when it comes to ICHRAs, what would you most like to learn about? So simply click one choice only in the box here, and we'll give a few seconds for people to tabulate their responses. So very interesting. It looks like market adoption and trends is leading with how ICHRAs work and compliance requirements, and then impacts on employees and their coverage choices close behind. And I can tell you, I'll be interested in what Paul and Ben have to say. Neither of those comes as a big surprise to me. So now we're going to turn it to Paul, who's going to talk a little bit about research findings regarding ICHRA in the research that he's conducted. Paul?
Thanks, Chris. And Chris, really appreciate that you took the time to be the moderator today. Can you guys hear me okay? Can everybody hear me? Okay. All right, thank you. And before I get started, I want to do a polling question. If you could bring up the question, please. The polling question is, looking ahead, how likely do you think it is that ICHRAs will become a mainstream option for employment-based health coverage in the next 5 years? And we'll give you a couple of seconds to answer that. And Chris, while we're waiting for the answer, there was a question in the chat related to your opening remarks about changing the acronym from ICHRA to something else. And there was also the choice acronym from the One Big Beautiful Bill Act, had it passed Congress, which it didn't. So we're still calling them ICHRAs. It still has the IC associated with the ICHRA, which I think is why people don't necessarily like the acronym. But let's see the answers. So 24% said it will become a major part of benefits, 66% possibly, and 10% said no, it'll just be a niche offering. And we'll see more different results of this polling question from a different audience during Ben's presentation. So let's talk about ICHRAs. Next slide, please. ICHRA's only been around for 6 years, but I've been thinking about this concept of giving people more control over some aspect of their healthcare for over 20 years. And you can see here I'm plugging an issue brief that we wrote back or published back in 2002, where in the issue brief I wrote, a number of health policy analysts have suggested that employers are rethinking their entire approach to managing employee health benefits. One option being considered would have employers giving employees a fixed amount of money that employees could use to purchase health insurance either on their own or through some type of group purchasing arrangement. So this idea of an ICHRA has been around long before I came to eBree, which was a long time ago. But it never took off. If on the next slide, there's this question as to, is it deja vu all over again? Back in 1970s, there were articles written in the New England Journal of Medicine about ICHRAs. We got cafeteria plans in the 70s that allowed employers to provide employees a little bit more choice. And I just want to highlight in 2007, the ERISA Industry Committee came out with a report called the New Benefit Platform for Life Security, which basically suggested that employers should go in the direction of what we now have called an ICHRA model. Back then, they were saying give workers a defined contribution or a fixed contribution and let them go shop on their own from an exchange that we're going to create. And then you started to see private health insurance exchanges pop up that could be paired with a defined contribution. On the next slide, I just want to remind people of a survey that was done in 2011. It was a long time ago, but the survey was of CHROs and mostly Fortune 500 companies. And they asked them, what statement best categorizes your company's strategy related to health benefits over the next 10 years? And 36% said they were giving serious consideration to moving to a defined contribution strategy. That's huge, right? That back then you had that many employers thinking about this. I always thought the headline was the next number, the fact that 6% of Fortune 500 companies said they were giving serious consideration to discontinuing providing healthcare benefits. That hasn't happened. And for the most part, the 36% that said they were considering a defined contribution strategy hasn't happened. It's interesting that this survey was fielded a year after the Affordable Care Act passed, which gave us, insurance market reforms like we had never seen before, things like guaranteed issue and subsidies for people below certain income thresholds that varied by income. And it gave employers the means to go to a defined contribution strategy, but they didn't. And I think one of the reasons why they didn't was when the ACA passed, and a lot of people were projecting this was going to happen, including myself, unemployment was over 10% in 2010, which is a high unemployment rate. And it's an employment rate where employers start to think, do I really need to do what I'm doing? Can I change things around? I don't have to be as concerned about recruitment and retention of workers. But it didn't go in the direction a lot of us thought for a number of reasons. And I think one of them is employers didn't want to give up control. Two is, despite the higher unemployment rate, they saw unemployment rates falling. They were going in the direction that would cause them to think this is probably not the right time for me as an employer to move to a defined contribution strategy or get out of the business of offering health benefits. Next slide, please. So what are ICHRAs? I hope everybody knows this by now, but in case you don't, and I'm not going to go over all of these bullets, you'll get the slides by email tomorrow. ICHRA, or individual coverage health reimbursement arrangements, I call it a fancy name for a way to give employers the ability to give workers money on a pre-tax basis so they could buy health insurance on their own. And then you've got all the, specifics about, what that means below that. And we'll go over some of that during the webinar, but it's just a way, we could call it different things, but it's just a way to give workers pre-tax money to go shop themselves. Next slide. And when we keep referring to 6 years ago when ICHRAs came out, that's because that's when the regulation came out from the first Trump administration establishing ICHRAs. And in the rule that they published back then, they projected that ICHRA enrollment would reach 1.1 million a year later in 2020. And by 2024, it would be almost 11 million, and it would basically be flat between 2024 and 2029. What really happened? If you go to the next slide, we did an issue brief over the summer, relooking at this issue of ICHRAs, and found that we might be between 350 and 700,000 people covered by an ICHRA today. So we're not at the 11 million. I'm not even sure we're at the 1 million point at this point. But this is a marketplace that's new. It's at its infancy, and I've always said that trends start with small numbers, and here we are, perhaps at the beginning of a trend. Next slide. We came up with these numbers a number of ways by looking at worker take-up of health insurance, and also the ICHRA Council research that they did, a survey of ICHRA administrators or ICHRA administrators. And it's interesting because they found that 83% of employers offering ICHRA, or a QSERA, which is another form, you could argue is just another form of an ICHRA, had not previously offered health coverage in the past, while 17% had transitioned from traditional group insurance. So what's happening with at least the early adopters is that they tend to be smaller employers that want to they haven't been offering health coverage for at least a while. Maybe they did in the past, but they're giving workers a new benefit, a new tax-free benefit that, I would think that they've done enough research that they think that their employees would want this kind of benefit. Next slide. I said that trends start with small numbers. We've seen the trend away from health benefits among smaller employers. That's the bottom line here. For the most part, large employers, and defined as 100 or more employees in this slide, just about all of them offer health benefits, and they haven't been pulling back. But I think that's probably why we've seen this product be something that small businesses are gravitating to first, because that's where they're filling a hole. Next slide. Back when HSAs passed, the HSAs passed in 2003, they became available in 2004. And there was a survey of employers back in 2004 and asked them, how likely you would be to offer health benefit, an HSA plan by 2006. And 19% said very likely, and 54% said somewhat likely. So you're looking at 73% likely to offer an HSA plan 2 years later. We didn't get there in 2 years. It took many years to get to the point where we're at. HSAs have been around now for just over 20 years, and maybe about a third, depending upon what survey you look at, 25 to 30% of workers with health benefits are in an HSA plan. So, I've always said trends start with small numbers. They tend to take off. They don't take off like a rocket, despite, what the hype may say, like with respect to HSAs here. They take off more like an airplane, slow and steady growth, which is what you've seen here. Eventually, they get to cruising altitude, and the numbers level off. And the next slide, if you want to, and this is just a repeat of the percentage of workers in high deductible plans or consumer-driven health plans. And the next slide, just to wrap things up, the comparison to retirement benefits is often made, that employers went to defined contribution retirement plans, dropped defined benefit retirement plans, and this shows the trend. It shows that the percentage of workers with a retirement plan and a defined contribution plan only was in the teens back in 1979. And it took the better part of 30 years to get to about 70%, where it was in 2010. And it's been, I think, level since then. So again, slow and steady growth over this long period. And, we'll see what happens with ICHRAs if it follows the same growth pattern that we've seen with retirement plans and HSAs, or whether or not it takes off even faster, which, we could argue that there are scenarios where it would. So I'll stop there and turn it back over to Chris.
Thank you, Paul. Just a little reminder that you can use the chat function at any time to send us a question, and we'll continue to compile the questions as we go through. And after Ben speaks, we'll address those questions. So next slide, please. We'll hear from Ben. Ben's going to share his perspectives on how ICHRAs are working in the market today and where they might go from here. Ben?
Awesome. Chris, thanks so much. And Paul, thanks for your insight. Appreciate the opportunity to be a part of this conversation. We can actually jump forward a little bit. We don't need to see anything about me. We can go to the slide right after this. So, in talking about where we are now, one of the things that comes up very often in the ICHRA space is the impact of technology. And what I can tell you personally is I was in the broker world in 2019 when the ICHRA came out, and we started talking to clients about it. And as you can imagine, there were some objections with any new legislation, with any new way of doing things. People are somewhat skeptical, and were very quick to point out some of the ways in which they felt that the ICHRA would not be successful. One of the first things that was said to me when I spoke to clients about the ICHRA was the R, the reimbursement. The idea that an employee who had a spouse and 3 children could potentially have a $2,500 a month premium. And the idea of someone who made $30,000 a year funding $2,500 a month and then waiting 3 weeks for a reimbursement was challenging to people. And so one of the early solutions that came in on the ICHRA side were payment solutions, which I'll talk about a little bit more in a minute. But when you look at other ways in which technology has continued to impact the ICHRA space, broker tools that have made it easier to quote and compare the ICHRA to a fully insured or a self-funded plan to show potential savings have made brokers tell the story to their clients in an easier way. What has followed are tools for employees to help them pick plans. It was another big area where people expressed concern of how are employees going to figure out how to pick the right plan. Well, they pick their own car insurance, they pick their own homeowners insurance, they make lots of complicated decisions when they have the right tools available to them. tools have come in to help support people through that process. And then, of course, the last piece being the enrollments. And we're seeing things in the industry that are making the enrollment process for ICHRA that much easier. So let's jump into each of these. We can jump to the next slide. Let's talk about the payment process. One of the things, as I mentioned, that was so overwhelming to people was the idea of how you handle those payments. And what we've seen are payment solutions that address the R in ICHRA. So we are intending to really flip the process from a reimbursement to taking employer funds into a banking as a service platform and then slicing it up into virtual debit cards or ACH accounts and submitting those to the carriers along with the applications. So from the employee perspective, you as an employee are simply just having a payroll deduction taken like you were when you were on that group plan. But it's made it much easier for an employer to be able to offer the ICHRA when they don't have to worry about the reimbursement side of things. Again, one of the things that makes this a little bit easier also is you can then terminate an individual form of payment when an employee leaves. And then they just flip over if they want to keep their plan and put their own payment information in. So payment solutions have made the ICHRA easier for an employer to administer. Let's jump to the next slide. Broker tools, as I mentioned before, have become a bigger piece of how a broker tells that story to their client and is able to demonstrate when there are savings. One of the big changes with the ICHRA, for those who aren't aware from the QSERA, was the addition of more classes. So you have 11 classes that you can use under the ICHRA. And when you work with a tool that demonstrates how you design an ICHRA using these classes, whether you're doing it by geography, by rating area, whether you're giving different amounts of money to salaried versus hourly employees. This helps you to design a really sophisticated ICHRA in a very simple way. And these tools are intended to first work with a broker to help them understand, does ICHRA make sense for my client? But then also to bring the client into the conversation to help with that ICHRA design. We often get questions from people, well, who makes the decision of how much money is given to the employees? The employer does. It's their funds. They are, in the end, the ones who are responsible for it. But with the right tools and working with a vendor like Zorro or other vendors that are out there and your broker, you're able to show a number of different options to help the employer with that decision process and come up with an ICHRA design that makes sense for everyone. Let's go to the next slide. So I know I mentioned previously decision support tools and the idea of employees having to pick their own plans. And I can tell you we regularly have employers who say to us, well, I offer 3 plans today, and I know people struggle to pick amongst those. How is it that they're going to be able to choose between 50, 75, 100? I'm in Cleveland, Ohio. I have 190 plans available to me. And what we tell them is with the right technology and the right support, they're able to do it. So you're seeing a couple of screenshots here from a decision support tool that helps to guide employees through the selection process using information that they provide, as well as information from the area in which they live. So the plans that are available, the doctors that are important to them, the medications that are important, all of these things go into that decision process. And it helps to take what can be a really large number of options and narrow them down to help employees to make that decision. You also can get them help directly with individual people who help with the enrollment consultation. But technology is making that whole process more efficient and easier for the employee to go through. Let's go to the next slide. So someone asked me during an interview if I could fix one thing about the ICHRA world, what would it be? And I said it would be the friction on the enrollment side. because we have, I believe the number is somewhere around 310 individual carriers across the country, if you take each individual carrier in all the states that they're in. And if we have 310 individual carriers, there's probably 309 ways that they want the data. It's a place where we do see friction in the ICHRA world. Once an employee has made their plan selection, the submission process to the carrier still involves some bumps. But we are starting to see a couple of things that are making us feel like this is turning around. One, we've got partners who are working on integrations, whether it's directly with vendors or through centralized areas like HealthSherpa, for example, where you're able to submit applications using pipes that already exist in the market. And you're able to do it using the off-exchange version of the products, which is where most of the ICHRA enrollees end up enrolling. The more we can make this an automated process, the less we rely on manual effort, the more efficient it's going to be, the less likely we're going to see errors, and the quicker you're going to see people having those insurance cards on January 1st, like we want them to. We can jump to the next slide. So let's talk a little bit about the case for ICHRA, and we can move on here. People have asked regularly when we meet with brokers or when we're meeting with a prospect, who is it that makes a good ICHRA prospect? And we've got a number of different categories of employers that are good prospects. So obviously high renewals. They've had bad claims history. They're coming off multiple years of double-digit renewals, and they're trying to figure out, how do I handle that risk? And the ICHRA, because you're spreading the risk across a much larger population, can become a place that is a really good landing spot for people and companies in that situation. We also see the modern workforce is highly distributed, people working all across the country. And there are times where a group plan, you might see, if you're trying to hit multiple geographies, that you're going to see a higher price as a result of that, where the ICHRA is going to allow people to purchase a plan that is local to them, and you're going to get a reimbursement amount that is local to you when you use the geographic class in order to break up your ICHRA. That way you can be, as an employer, more efficient with your healthcare dollar. Cost-sensitive employees and people who really want to right-size their coverage are another great target for the ICHRA, because again, it gives those employees the opportunity to pick something local. I've talked about the risk fatigue, but one last thing, the high employee turnover group is something that we see around low enrollment numbers. Carriers often have minimum enrollments. It could be 50% or 60 or even 70 or 75%. Under the ICHRA, only the people who want coverage need to take coverage, and you don't have to worry that a carrier's not going to take you. So when you see the hospitality industry, for example, which generally has some very low enrollment and as a result can have some higher rates, the ICHRA becomes a really good match for that, because the rates are not dependent on who enrolls. The rates are already predetermined. Okay, we can move to the next slide. So we have lots of conversations at Zorro with brokers, as do our friends, other friends in the ICHRA space. And what we're seeing is a really high interest in the ICHRA, especially over the last couple of years. Survey that we did earlier this year showed over 90% believing that ICHRA is going to play a role in the benefit landscape. More than half the brokers that we were talking to are already selling the ICHRAs. And we are seeing regularly that the rising group rates, which there are some conversations that we're having that are 50, 60, 70% on the group side from a renewal perspective, we're able to really do a lot on the ICHRA side to mitigate some of that increase. Let's move to the next slide. One of the questions that often comes up for the broker is, what's my role in this? Our attitude at Zorro, and I know a lot of our other friends in the ICHRA space feel the same, is that the broker still belongs at the center of this relationship. They are driving the relationship. They are the strategic advisor for that client, and they're bringing in an ICHRA vendor as a trusted partner to execute on this solution, to bring in the allowance modeling and the AI support and the platform to manage it, and all of the pieces of the ICHRA that you as an employer need in order to successfully manage it. But the broker still lives at the center of that, and the broker has that strategic relationship. Let's go ahead. Okay, I'm going to talk about just a couple of trends before we wrap up. We can jump to the next slide. I'll touch on this quickly. This slide comes from our friends at IDEON, who put a lot of the plan data together from across the country. What you're seeing in the map on the left is a lot of purple and not as much green. That's from 2019, where this showed where the small group rates were outpacing, from a price perspective, the individual market. What you're seeing on the right from 2025 is a lot more green. So you're seeing many more ICHRA-friendly areas of the country where the individual market is providing, from a price perspective, options that give employees choice where they can save. We're also seeing many larger companies who are looking at the ICHRA, and that's been the largest area of growth from an ICHRA employer perspective over the last couple of years. So let's go to the next slide, and we'll go through this, and then we can open it up for discussion and questions. So I know we talked previously about some things that were in the One Big Beautiful Bill. The ICHRA stuff got cut out of it. So the ICHRA, although it's not codified into law yet, there is currently additional legislation that has been put in front of Congress to hopefully get that done. There is no risk that we believe of it going away. There is significant bipartisan support for it. We're really excited about the expanded HSA eligibility with the bronze plans and the ability for people with an HSA to subscribe to a direct primary care practice. These things are all positive ways in which people can use those ICHRA dollars. We are still in a wait and see mode here as we sit on September 30th. Anybody who's paying attention knows that there's a major discussion around whether the expanded tax credits will continue, and we're all just going to keep watching very closely for the rest of the day to see what happens. I mentioned that the carriers are making significant investments in ICHRA. That comes in a couple of different ways. One, we see them investing in more off-exchange plans that look similar to what people are used to from the fully insured side. That's really exciting to us. And there are a number of individual market carriers who are investing in their ICHRA teams. So there's a higher level of service that you would get as a broker, as well as individual employees. We know that group rates are going up. And again, the hope is that there is an opportunity for the ICHRA to mitigate some of that. And I've spent enough time, I think, talking about the technology. So why don't we pause there? I think this was my last slide. And we can jump into the discussion and question and answer portion of the program.
Beautiful. Hey, thank you, Ben. That was a really comprehensive discussion and a lot of really good stuff. Not surprisingly, there are a lot of questions. Again, you can continue to put questions into the chat at any time. We'll get to as many of them as we can. I'm going to go right at it, Ben. And there have been a number of questions that have come in that have been variations on the same theme, which is, I can see why this is a really good idea for employers because it helps
Yes.
them sort of codify and in a way fix and control their costs.
Sure.
I'm having difficulty figuring out what's in it for the employee. So do you want to address that one?
Sure. So, I think there's a number of things in it for the employees. The employee, and especially if you think about people who are younger, who are very accustomed to creating their own experience, whether it's in social media or their news feed or what they watch. They are used to customizing their life. And now you're able to provide that from a benefit perspective as well. They're able to right size coverage, whether it's a carrier that they're interested in. I mean, imagine someone lives in an area that has Kaiser and they've been a Kaiser person and their employer chooses a non-Kaiser plan. If all of a sudden they offer the ICHRA, they get to go back to Kaiser. If they're in a place where there are particular carriers that only work with certain providers, again, you get to put yourself in a position where you can pick a carrier that is with the provider that you're interested in. You also can look and say, you know what? I don't need to pre-buy my claims. If your employer offers a gold plan or a gold level plan, and you're someone who doesn't go to the doctor very often or doesn't take many meds, you might be willing to say, I'll spend less on my premium to take a higher risk with a higher deductible. But if your employer only offers two plans and that option's not available, you're stuck in that situation. So that's where we see employees being able to benefit from this.
Yeah, I would just add that some employees are going to love it, some are not, right? Because people aren't used to shopping for health insurance. And I think one of the reasons why employers haven't gone in this direction is, the technology just wasn't there to help people navigate. And the technology has caught up to this concept of a defined contribution and giving people choice, to go out on their own. And economists have been saying for years that, one of the shortcomings of the employment-based system is job lock. People stay in jobs they don't want to be in to keep their health insurance. And ICHRAs will, help people move about. If everyone had an ICHRA, there's no more job lock, right? Although job lock might be tied to the contribution rather than the plan that's being offered. So I think some workers will find this very attractive, but then, and especially younger people. But when it comes to older workers, also there, some are going to find it very attractive. Going to be like, what took so long? And others are going to think, I've never shopped for health insurance before in my life. I don't really want to start now.
So, Paul, I think you just walked into another question, a rather provocative question that was asked, thoughtful question as well, which is, let's flip it over the other way. You talked about the fact that ICHRA in the purchase of individual health insurance gets rid of the job lock, right? So is there, and I'd leave this to either one of you to answer, or both of you, is there a downside to employers in the sense that that golden handcuff is now released? And does it potentially make it easier for people to switch jobs?
Yeah.
So, Paul, do you want to go ahead?
Yeah, I
Go
think
ahead.
I think it does make it easier for people to switch jobs, and some employers, it could go both ways, right? You're going to have some employers that want to keep people around and offer the benefit to do that, and they, want to take advantage of the fact that they've, provided on-the-job training, they've invested in these workers, they've invested in their health and want to see the returns to their health plan. But some employers are going to take the attitude that I've got people working for me that don't want to work for me. And I want to get the right people on the bus. And in order to do that, I got to make it easier for people to leave. And then it's up to me to, find the right people to work in this environment, whether it's an environment where you're back in the office or hybrid or working remotely. There's all kinds of aspects to work in here that we could get into that I think employers would find attractive. Plus, they don't have to offer the benefits, right? It's much more simple. Um, you know, than what they're doing now and all the evaluations they're doing. But they may also think that a lot of employees don't have the wherewithal to choose their own health plan or to navigate this, and we want to provide a good benefit so people are not just present at work but productive at the same time. So it's not just about health; it's about productivity, absenteeism, presenteeism. So I don't think there's one size fits all rule for the way employers are going to think about this.
One thing to add on to that is I think it depends on if you offer an ICHRA and if you find significant savings, which people do, what are you doing with those dollars? How are you telling the story to your employees of I'm continuing to invest in you? So we've got a client, for example, in Pennsylvania, about 200-person nonprofit, saved, I think it was almost $400,000 with a transition to the ICHRA. They were incredibly generous with their ICHRA offer, funding basically 100% of a low-cost gold plan. Now, people bought up and bought down, but they took the savings as an employer and invested in additional benefits. So the pitch to their employees was, yes, we're no longer offering a group plan. It's now individual. You're going to have to make this choice. But in addition, we're now able to offer you X, Y, and Z, whether it's an additional percent or two on salaries or additional contribution to your 401k. But you as an employer, if you're saving, what you do with those savings, I think can say a lot to how you retain your employees.
Thanks. That's good. Paul, to one of the comments and statistics that you gave in your portion of the program here, we had a question about the early adopters of ICHRA and that interesting statistic that 83% of the employers who are offering individual coverage HRAs are doing so and in the context of offering health insurance benefits when they didn't offer them before, and only 17% are replacing their group plan with an ICHRA. Sort of a two-part question. The first is, do you know, was there a statistic coming out of that gave a correlation to the number of employees as opposed to the number of employers? In other words, big firm, small firm. And then the second piece is, what does that statistic tell us about, at least to this point, ICHRA's role in expanding access to health insurance benefits as opposed to replacing or disrupting traditional group coverage?
Yeah, it's a good question. On the data point, I don't recall whether I don't think the HRA Council put it in terms of workers, right? Those statistics. But I do know that overall about 80% of workers are offered health benefits, so only 20% are not. That's not by firm size, right? I don't remember what the numbers are by firm size. I know that they're higher in the small group market. Fewer employers offer it, fewer employees are eligible for it. It's complicated when you've got two income families where one family might be working, one member might be working with health benefits, the other one may be working without it because they don't need a job that offers it because they get coverage through their spouse. But 80% of workers are offered, at least 80% in the private sector are offered health benefits. And I think the number is higher in the public sector. I just don't have it offhand. I do find it interesting that the early adopters are employers that don't offer health benefits because at least initially, it suggests that it's increasing access to health insurance, right? By giving people, funds on a pre-tax basis to go out and get a benefit that they're not being offered. There's a question of how, what's the hiccup, and that's why I think our numbers are lower than others because we're factoring in, the fact that some of those workers being offered an ICHRA don't need it because they're getting coverage through a spouse, so they're not taking the ICHRA. But it'll change eventually, where you'll start to see employers switching out their traditional coverage for an ICHRA. It's just I think the biggest question is, you'll see it in the small group market. The biggest question is, when does it happen in a large group market? Like who's the first large employer to make such a move so that others follow them, right? Because when it comes to a major change like this, most employers don't want to be first, but they also don't want to be third. So everyone's looking around to see who's going to be the first mover. And I'm not talking about large employers in the 100 to 150 range. I'm talking about large employer, jumbo employers, 5,000, 10,000, 25,000 employees or more that are going to wait and look around to see, which one of their competitors is doing this. They'll want to know how it's working for them. But there always tends to be a herd mentality when it comes to employer behavior.
Ben, I got one for you.
Yeah.
We've already talked about a few misconceptions, a few questions and concerns people have about individual coverage HRAs. What are some others that you hear most often, and how do you address them?
Yeah. So, I talked in my earlier presentation about a couple of the things, the payment solution, the inability of the employees to be able to pick plans. But I think the thing that comes up the most often is the concern around the quality of the plans on the individual market, and that it's not an apples to apples comparison with what people are coming from. And what I would say to that is not every geographic area has been created equal from an individual market perspective. There are some parts of the country that have a highly developed individual market that has a range of plans, some narrow networks, some broader networks that give the employees the ability to really successfully buy up and buy down. There are other areas of the country, although they're becoming fewer and fewer, where you don't see as many options. And I know I mentioned this a little bit before, but what we're really seeing from the carriers is a recognition that the off-exchange plans can be where they can put things in place that look a lot more like those fully insured group plans that people are coming from. Broader networks, potentially higher reimbursement rates to providers, and although they might come with a little bit of a higher price tag, if that's the complaint, and generally what we find that complaint, it's coming from the higher compensated employees. So someone says, well, can I buy up and spend more to have that broader network or have that particular provider in network? The recognition that that's important to people and the carriers taking the opportunity to bring out new product is really, to me, going to continue to drive the success of the ICHRA. Will there be people who continue to buy down to a bronze plan? Absolutely. We're not as worried about those people. We know those options are there for them. But with those people, the other piece that I think there's a real advantage is now, and I know this was briefly touched on in my presentation, now that you've got the ability to pair an HSA, to use the HSA for DPC, you actually might see people who are saying, look, I'm going to save a ton of money on my premium. I'm going to take those dollars, put them in an HSA account. I'm going to subscribe to a DPC practice, get the bulk of my care there, and I'll use my bronze plan as like individual stop loss. And so that's a level of thought and creativity that we don't see very often on the individual side of things. So that's how we're starting to counteract some of those complaints, taking what someone views as a complaint and turning it more into an opportunity.
Thanks. Got one for you, Paul. You have probably been studying ICHRAs for as long as anybody in the country, certainly a very long time. As you look at your research agenda going forward, what other questions, what other areas of interest do you expect to probe in your research?
Oh, I've got so many questions about ICHRAs that's going to keep me busy the rest of my career. And I think a lot of these questions have come up in the chat, right? Because people have the same questions and we don't have all the answers yet. How rapidly are they going to be adopted? And how's that going to vary by employer size and industry? What factors are going to influence employers' decision to go to an ICHRA? How do they affect employee satisfaction? What choices do people make? Do they, in the group market, you see inertia. People tend to, when they have a choice, people tend to re-enroll in the same plan. Are you going to see that in the ICHRA marketplace? Ultimately, what does it mean for workers' health? Do workers understand how to select and use individual market plans effectively? What are the financial implications for them? What does it mean for job lock, like we were talking before? So there are other questions, and I've got a whole research agenda around this. If I could make a shameless plug, we're launching an ICHRA survey, a survey of employers to better understand their attitudes and interests in ICHRAs. And it's going to be a survey of small and large employers, small employers that offer health benefits, small employers that don't, and large employers that do, because just about all large employers do. And I think it'd be hard to find the ones that don't for a survey like this. And we hope to field this survey pretty soon. We're looking for funding for it, and if anyone's interested in learning more about the survey, they should contact me. It's very easy to find me, paul@ebri.org. and we can talk about the survey. But that's our short-term research agenda, is fielding the survey to better understand where employers are coming from, and longer term to get at some of those questions I mentioned and others.
Thank you. Ben, we've had 2 or 3 questions pop up in the chat window around something that you said in your presentation, which was that the majority of purchases that individuals make of health insurance take place off of public exchanges as opposed to on public exchanges. And the universal question has been from each of these questioners has been why?
Yeah, so it's a good question, and one of the things that I didn't address in the presentation, which let me just talk about it quickly right now, is that if you as an employee receive an affordable offer of coverage from your employer, you're no longer eligible to take the tax credits that are available when you purchase on exchange. The ICHRA dollars and the advanced premium tax credits are not stackable. They are one or the other. So, as a result of that, and the fact that we're working with employers who want to continue to make an offer to their employees, generally we are enrolling people in the off exchange version of the plan. So, as a result of that, a couple of things. One, you in many cases have the ability to have plans, as I mentioned before, that are going to look more like some of the fully insured plans that people are used to seeing. The other thing is, with a cafeteria plan, when you buy off exchange and you use the payment solution, the employee has the ability to take their portion pre-tax, which we know is really important to a lot of employees to reduce their taxes. So we, in every case possible, are going to put people in the off exchange plans. There are a couple of isolated situations where you'd find only an on exchange version of a plan. And yes, you do see people in there. They're giving up the ability to deduct their portion, but almost all of the work we do is in the off exchange side of the market.
That's very interesting. Thank you. And it's probably worth pointing out that the choice arrangement provisions that didn't make it out of the final version of the reconciliation bill actually would have fixed that disparate tax treatment for on exchange plans, but we'll have to wait and see
Yeah.
where we go legislatively from here. The current law is obviously, as you said, it was.
So can I make one comment on
Yep.
that? I did speak to someone at a carrier who actually pushed back on the idea that we should do that, because his comment was he doesn't want people in those on exchange plans. He wants to continue to have off exchange plans that are in some ways more valuable to that population, potentially reimburse a provider at a higher rate, and that on exchange plan has a different design to it. And that's okay that there are people who are choosing those. There is a market for them. So, it's going to be interesting to see how that plays out. But there are a couple of pieces of legislation. There's codifying ICHRAs into law. There's that piece we're mentioning. There's some small business promotion around the ICHRA. So there's still a lot of energy around the ICHRA legislatively.
Chris, can I ask Ben a follow-up question to that?
Yeah.
When I hear off exchange and on exchange, I think on exchange plans with guaranteed issue, modified community rating, and off exchange, I think you could be denied coverage if you have a pre-existing condition. How does that work in an off exchange
No, they're
plan?
all so everything, because it's still all sits under being qualified ACA plans. There's still the guaranteed issue. You're not having individual underwriting. There are still the same advantages that you find with the on exchange plans from that perspective. So it doesn't change anything.
Thank you.
Yeah.
So here's a question for each of you, and it's perhaps the question. What do you think, and what are you seeing as the biggest barriers to adoption by employers? And I think, based on the questions that have come through, shading probably more toward the large end of the market than the small end of the market. and what needs to happen for adoption to increase?
Paul, you want me to take this one to start?
Yeah, yeah, and
Okay.
I'll jump in after.
Okay, so I see three things. One, the plans need to continue to look more like what people are accustomed to on the fully insured side. Um, as much as people don't need a PPO, they still believe they need a PPO. And we find there are a number of geographies where those plans don't exist. So the more that we put ourselves in a position where we're able to find comparable plans, the better we'll be. Second, continue to improve from a technological perspective, the efficiencies in the market around enrollment. So bulk enrollments, direct connections to carriers, the ability to take this data in a way that does not require a huge amount of human work. Because right now that can still be a drag on the ICHRA and can cause additional frustration during the enrollment process. The third, I think, is a huge amount of education needs to continue to happen through the broker world to their clients around how you manage the culture change that comes along with the ICHRA. I can tell you we run into situations with groups that would see significant savings where you would have employees enrolled in very similar plans, have very similar networks, and still have a high level of coverage, but the culture change feels too much to them in order to make that change. You know, Paul, you mentioned that nobody wants to be first, but nobody wants to be third. Um, the more we continue to educate people that there are ways to overcome these obstacles that currently exist, the better position we'll find ourselves in to see the ICHRA continuing to grow.
Yeah, I'll be real quick. I think when it comes to large employers, they're spending a lot of money on health benefits, and they're curious as to how they might save money in an ICHRA because you can't just set the contribution and forget about it. You still have to meet the ACA affordability requirements. So defined contributions in retirement often are pegged to a percentage of pay, and defined contributions in ICHRAs are going to be pegged towards a percentage of the premium, right, in terms of affordability requirements. So it's not as simple as set it and forget it. And I think as long as employers feel like they're spending the money, they want control over how that money's spent, which is one of the reasons why they're hesitant. I think that, if we were to we still haven't had a recession since the ACA passed, other than the one associated with COVID, and that was short-lived. And a lot of people were laid off, but a lot of workers were furloughed and kept their health benefits until they went back to work. And I think employers didn't want to do anything to take away health benefits during a national health emergency. But if we get back, we're still at record low unemployment rates, or unemployment rates that are low enough that despite signs that the labor market might be softening, employers are still looking at 4% unemployment. So they don't want to do anything that might be seen as radical for now. But I think if you had a recession, unemployment back in the 10% range, you'd have more employers consider, at least the larger ones, considering this. And it's a whole lot more difficult for a large employer to make such a change because you don't have one location like a small employer might. You have employees all over the country. You have to communicate this to them. You're already doing that in some respects with your health benefits. But now you have to do it in a way where you're not just tinkering with the benefit, you're completely changing the benefit.
Well, thank you both, Ben and Paul. We could go on for probably an hour or more. We have so many unanswered questions, and I apologize that we couldn't get to even a bare fraction of them. But thank you both for your valuable insights. A special thank you once again to Zorro for sponsoring today's webinar. And just a reminder, and for those of you who weren't on at the very beginning, there will be both the slides and a recording of this session will be available on the ICHRA website, perhaps as early as tomorrow, but certainly within the next couple of days coming up. Before we go, I would like to highlight two upcoming events for you to mark your calendar on. In 3 weeks, the 2025 ICHRA SHRM Health Benefits Symposium, and I believe that online registration for that is going to open up for the webinar live stream as early as next week, maybe even Monday. And then in December, we are going to have the eBrief Financial Wellbeing Symposium. And if you're not an eBrief member today, I urge you to learn more and consider supporting this organization. For over 4 decades, the Employee Benefit Research Institute has provided valuable research, and it really contributes to conversations and decisions that employers and others make with regard to employee benefits. eBrief's research is independent, it's nonpartisan, it's rigorous, and it's highly respected. So you can scan the QR code on the screen, you can visit ebrief.org, or you can email us at info@ebrief.org for more information. Thanks again to everyone for attending today's webinar, and have a great day.